provisions to protect breastfeeding. The Sri Lanka Code and the Labelling and Advertising Regulations under the Food Act give legal protection and encompass several stakeholders: the community, health system, media, and the industry. And then there are circularized instructions to the health system and health staff issued by the Ministry of Health from time to time, legally binding them towards protection of breastfeeding, considering the multifaceted challenges faced by the health staff in protecting, promoting, and supporting breastfeeding. The International Code was adopted at the 34th World Health Assembly in May 1981, and as a country we are very proud that the Sri Lanka Code was formulated by an eminent panel of experts the same year in September 1981. And in 1983 it was gazetted under the Consumer Protection Act number 1 of 1979. The Sri Lanka Code was revised in 1998 and the relevant provisions gazetted under the Consumer Affairs Authority Act number 9 of 2003. The purpose of this endeavor was to contribute to the provision of safe and adequate nutrition for infants and young children, not to ban infant formula. And to achieve this objective, according to the hard scientific evidence, infant and young children required to be breastfed and provided with safe and adequate home-cooked, nutritious complementary food. In addition, it is of paramount importance to ensure proper use of infant formula, which means using infant formula only when it is strictly necessary. The Sri Lanka Code has 8 articles covering relevant stakeholders, and under each article there are several sub-articles. Promotion of breastfeeding by healthcare staff as well as media personnel has been made mandatory. Articles 2 and 3 cover prohibitions in terms of marketing and promotion of designated products and commercial complementary food. And healthcare systems and healthcare workers are covered under Articles 4 and 5. Then Article 6 and 7 covers the industry, and finally Article 8, the implementation and monitoring. Considering the importance of provision of safe and adequate nutrition for infants and young children, the Sri Lanka Code covers a range of products which, if indiscriminately used, can have a negative impact on child health and nutrition. Products regulated under the Sri Lanka Code are termed designated products. Thus, the scope of the code includes not only infant formula for children up to 1 year of age, but also bottles, teats and pacifiers, as well as commercial complementary food. The Sri Lanka Code prohibits advertising and promotion of these products to the general public and families within the healthcare system, and also clearly specifies prohibitions in terms of healthcare worker engagement, including but not limited to obtaining financial and material inducements, gifts, other incentives, fellowships, study tours, donations and free samples. Labeling criteria are included under the article number 2, sub-article 2.3, which prohibits images that may idealize infant formula and any text that may discourage breastfeeding, and as requirements, a statement on the superiority of breastfeeding as an important notice to be included, and the decision to formula feed not to be taken without sound medical advice. The responsibility of monitoring of the code lies with the Ministry of Health, and the Family Health Bureau is the responsible agency as the technical focal point for maternal and child health within the Ministry of Health. And law enforcement is with a different agency, the Consumer Affairs Authority, as mentioned previously. Therefore, the efficient functioning of law enforcement work is underway to take over the responsibility by the Ministry of Health to be of a similar modality to the implementation of the Food Act. Sri Lanka is a signatory to the World Health Assembly resolutions and the Convention on the Rights of the Child, and we know that every child has the right to good nutrition according to the CRC, where breastfeeding is specifically mentioned considering its importance for child health and nutrition. Therefore, the subsequent World Health Assembly resolutions have been circularized together with the relevant provisions of the Sri Lanka Code for Healthcare Workers. And several circulars have been issued from the Ministry of Health. There are circulars that prohibit promotion of milk powder in healthcare institutions where the scope has been expanded beyond the Sri Lanka Code to include any branded milk powder, not only infant formula. In 2012, all relevant provisions pertaining to healthcare systems and health staff in the Sri Lanka Code have been circularized to prevent violations of the provisions of the Sri Lanka Code within the healthcare system. The most recent circular by the Director General of Health Services, issued in 2018, has incorporated the relevant provisions in 2016 WHO resolutions. There are also these circulars which are specifically on prohibiting obtaining sponsorship from milk food and commercial complementary food industry, since such practices would be a conflict of interest. The most recent circular on compliance with Sri Lanka Code also includes recommendations of subsequent World Health Assembly resolutions, including 2016, as I mentioned before. And I would like to draw your attention to an important clause there, that companies should not sponsor meetings and an event of healthcare workers or healthcare systems, and on the part of the healthcare workers, that they should not obtain such sponsorship from the industry. Apart from prohibition, since it's the responsibility of healthcare personnel to promote and support breastfeeding as an evidence-based intervention for child health and nutrition, there are circulars on the baby-friendly hospital initiative with the 10 steps for the curative sector, and also on creating a supportive environment for female employees to breastfeed or maintain lactation, such as provision of creche facilities and breastfeeding corners in workplaces. An instance where breastfeeding needs to be strongly promoted is during emergencies, and comprehensive guidelines on infant and young child feeding during emergencies for health staff are available, which also have been circularized. The Food Act regulates and controls matters pertaining to manufacture, importation and sale of food and beverages. The labeling and advertising regulations under the Food Act have been revised and gazetted recently and will be effective from January 2024. By these revised regulations, some of the gaps identified in the breastfeeding code have been rectified. For example, the age limit where commercial milk formula cannot be advertised has been increased from the age 1 year to 3 years of age. Further, the use of children or their images up to the age of 12 years in any advertisements or promotional material is prohibited. I will end my brief presentation by reiterating the importance of protecting, promoting and supporting breastfeeding by upholding not only the legal provisions but also the spirit of the code to ensure good health, nutrition and well-being of children in our country. Thank you.
Thank you, Madam. Dr. Abner Danny.